Hello, everyone. I'm Karen Katchik, and I'll be today's moderator for our Global Momentum webinar on localization, the catalyst for success in life sciences. We have a terrific trio of guests who will introduce themselves in a moment. First, let's start with a couple of housekeeping items so that everyone knows how to participate in today's webinar. So please use the tab that's called Q&A to enter your questions for the panelists. We will have ample time to address those in the last 15 or 20 minutes. There's also a live chat panel where you can connect with other attendees, or you can message one of the participants. Feel free to use that. And if you'd like to tell us now where you're logging in from, we welcome knowing who you are and where you are. We'd love to meet you. You can turn on Zoom's automatic captions feature if those are helpful for you for accessibility. And we are recording today's session, so you'll receive that replay by email in the next little while. If you want to connect with any of the speakers, we are happy to facilitate that. We'll give you their email, LinkedIn profile, etc. So don't hesitate to ask. And that's enough for housekeeping. Let me frame our discussion now. Since October, we have been releasing content in the Global Momentum series. It's designed to help people in life sciences who handle localization on top of their everyday role. So we're thinking of you in clinical operations, in regulatory affairs, and labeling, in marketing, in quality, in communications, wherever you are in a life sciences company. And many of you will have seen some of the content pieces. So this is your chance to respond and to ask some questions. So let's dive in. I'm going to let the panelists introduce themselves. Please tell our audience about some of your experience at the intersection of life sciences and localization. And David, should we start with you?
Yeah, thanks, Karen. First, thank you very much for inviting me. I'm really excited to be here. Bit about me. I'll be humble, I promise. Yeah, I've been in the localization industry for 20 years, there or thereabouts. Started off at language service providers. Many of us do, working specifically with life science organizations for a number of years. I've worked client side for CRO, and now I am here at XTM, where we work with many life science organizations delivering technology.
Look at that. I was, yeah, so you've been on both sides of the equation here.
Yes.
So look forward to your insights with that perspective. Bruno, how about you?
Sure. Hi, everyone. And thanks again for inviting me, Karen. Very nice to be here. So my name is Bruno Herman. I'm based in Brussels, hence the background behind me. I've been in the globalization and localization space for 31 years now. I started in 1994, first on the supplier side and then on the client side. I'm now a consultant, an advisor for companies in the life science industry that are willing to expand internationally with content, with processes, with technology. And my previous job, that's probably where many people used to know me. My previous job was in the global CRO in the world, leading CRO in the world, where I built the full localization operations team from scratch. So that's about me.
Yes, thank you very much, Bruno. Eva, can you tell us a little bit about yourself?
Yeah, thanks for the invitation, Karen. So I'm Eva Stabenow. I'm currently based in Nashville, Tennessee, and I have a binational background, Germany and the US. And I'm here to represent sort of the localization part in the trenches, because that's where I started out in 1995. I came straight out of grad school and went into software localization, and later worked more into medical topics. And so I've done a lot of software localization. I've done a lot of clinical trial work, a lot of patient education, a lot of, any document, any therapeutic area you can think of, I've probably worked in it. I'm one of those odd lifelong freelancers. I decided to do this right out of grad school because I wanted to be a conference interpreter, but life doesn't always quite work out the way you plan it. Because I basically had too much work from the get-go. These days, I mostly do content and copywriting in the medical and health field, some patient education, some writing for apps, and then I also do a little bit of localization consulting, still freelance.
Yeah, fabulous. So as you can see, audience, we have a great trio here with lots of different perspectives. So let's start off with you, Eva, if you wouldn't mind. So you must have seen every localization pitfall there is over the millions of words that you have translated. And now you're helping people write their source texts and presumably helping them avoid some of those pitfalls. So can you tell us a little bit more about that? Give us some examples, something that our audience might learn from.
Sure, I think you're probably right. I must have seen pretty much everything there is out there.
Yeah.
I think I do want to start with a concept that localization and translation in general is often an afterthought, and it really shouldn't be. It's a process and it needs to be planned for. It should ideally be planned for when or before you're writing content, because especially when you're aiming for patient engagement, when you're working in regulated industries, you need to make sure that that content is accessible and that's going to translate. So the content matters, the language level matters, the register matters, whether you are writing in plain language, to what extent you are using or avoiding cultural specificities that may need to be localized. Those things should be thought through ideally. Now, I realize that's an ideal scenario, and that's not exactly how it works. Some typical things I see is that, especially people who are monolingual English speakers are not aware that other languages may have different forms of address. So for instance, in the clinical trial space, you are going to need to keep the content aimed at providers and at patients, especially if in the pediatric population, separate, because you have different form of address, different register that you're talking to people in, that people are not aware of, maybe images are not being suitable, or humor not translating. Images, for instance, if you have like a CPR video and you've got an image, and it may not be appropriate to have a male and a female person in the same image together for certain cultures, things like that. Basic things like date and time formats, those are different across cultures. And it really gets challenging in the software space, which also can overlap with the medical space, is if you use variables when you're writing. So if you say, for instance, I'm going to use a very non-medical thing, say, I don't know, the whale. In English, that works everywhere. But in German, for instance, you have a declension. So you have to change the word depending on where you are. And it gets really bad if you then add, I don't know, the white whale. My husband's reading Moby Dick right now, so that's why I'm thinking of white whales. But I think that's a memorable one, because in German, it would not be the white whale of the white whale for the white whale and all that. It is much more complicated. The words change. In addition, for German specifically, we have split verbs. So certain verbs may need to be split, where one part of the verb is in the middle of a sentence and the other part at the end for certain constructions. So if you have a variable, that gets problematic, and then it gets really bad if you 2 years later change the variable and it says something different. So those are some very basic, typical things. One more thing, maybe think about who you're hiring. You need to have somebody who's a subject matter expert and not just a language expert. They have to know what they're talking about. They have to know how to write for the population you are targeting. So they have to be good writers as well, and they have to be aware of these things. So they should be the experts and not just somebody who happens to know 2 languages. There is a lot more to localization than that. And you can get a lot of benefit out of working with people who are qualified. And I know Vistatec does that, and many other great organizations do that, but that is something really important to keep in mind.
Well, David, Bruno, lots to jump in on there. Who wants to go first?
Well, I think you're right, Ava. I think I've seen this over the years, right? I think things like pluralization, regular expression, cultural adaptation is really, really important when it comes to content creation as well as content adaptation. and localize a full guild strategy, if you will, is really important when it comes to understanding the market that you have, especially with things like clinical trials. I think even the processes themselves, in my own opinion, might I add as a caveat there, is quite archaic in the way that things are done. Of course, life sciences industries as a whole is coming more into the 21st century with the migration from, let's say, pro to e-pros and eCOAs and things like that, right? So I would echo your sentiment there, Ava, and say I think it's really important that you have subject matter expertise in the right way, either as an individual or as a group of individuals that can then create that as it impacts the patient themselves. Because with the regulated industry, I think really that's something that we need to be cognizant of the patient at the end of the day, because that then is feedback in the loop, right? And that's also impactful for the translation industry as well, right?
Sure is. Bruno?
Yeah, I agree with everything that has been said so far. I would just make 2 points, probably, just to complement what has been said. The first one is that I think that some people do not suspect how complex global content operations or how global content supply chains are in the life science industry. I think many people are aware that when you talk about content translation localization, of course, it's part of the supply chain from creation to delivery. But what some people don't really realize, in my opinion, is that it's much more complex than that, because it depends on the type of content that you are dealing with to localize and translate. It can be pharmacovigilance, it can be clinical trial, it can be real world evidence. All these different, I would say, areas or sub areas of a CRO or a pharmaceutical company are really posing some challenges which come in addition to the traditional or conventional translation localization pitfalls like Eva and David just mentioned. So I think that's this level of complexity is really important to keep in mind. Otherwise, you might just wonder, okay, why are these people telling so much about what they do? It's because there is a lot to do, first of all, and translation localization is very challenging in more than one way in the life science industry. And the other point I would like to make, and this is just to circle back on something that Eva mentioned about the resources. I think if I look back at my years in the CRO world, there was always one complaint that was coming up all the time, which was we cannot find the linguists or the translators who are also knowing the domain. So they are great linguists, they are experts in language, but we need more than that. We need experts in the domain. If you translate for oncology, you need to know more about oncology. If you translate about, cancerology, then you need to know more about cancer. So this blend of language expertise and domain expertise is still today quite hard to find. So that's just to add to the pitfalls.
Yeah. Anything else, Eva, David?
I would want to jump in on that one because I do agree to a large extent, but I also think that people who don't know the industry that well are sometimes not looking for the right things. You are not going to find somebody who has an MD or a PharmD and a life science and a linguistics degree who is going to work for low end of the industry wages or who is even in this industry. So that expertise can be acquired in different ways. You just have to know how to look for it. A really good translator will be very able to get up to speed on things well, but you have to give them the time and the resources and pay them appropriately to be motivated to do that. Now, having said that, because translation is not, you don't have to have a certain, it's not like an MD in translation that you have to have in order to be able to practice. There are a lot of people in this industry and you don't know how good they are. So you have to kind of know who you're working with. And you generally, the good people in the industry like you and I and many of the people that we work with at ATA and other organizations know what they're good at. So I will happily translate across the medical field mostly. I'll be careful with medical devices because engineering is not my entirely strong suit, but I will not touch finance with a 10-foot pole because I really don't know enough about it. I don't have an MD, I have an MPH, but I do have, expertise, and I know people who are very, very good software localizers who have a lot of expertise. They don't have a degree in computer engineering, but they know what they're doing. So I think that it's a little bit squidgy what you're looking for, and that can be very mystifying if you haven't worked in this industry for very long.
Yeah.
Yeah, and I would add, I agree with that. I would add that from a translation or from a translator perspective, I should say, what I've seen over the years is that a number of translators and linguists were, of course, linguists by education, but they managed to gain a lot of knowledge in certain fields of life sciences, as I said, oncology or other specialties. And I think that, that's the reason why today, when I'm talking to some decision makers in the life science industry, I tell them to find what I call, that's my own terminology, the T-shaped linguist. The T-shaped linguist is actually someone who has a vertical knowledge of something or different specialties. So that's the vertical bar of the T. And the horizontal bar of the T is actually the general knowledge of the language itself. What is correct, accurate language. So that's what I said before. It's a blend of domain expertise and language expertise. And I usually present that as, as I said, as a T-shaped linguist. And I think, more often than not, in my experience, it's a matter of will. If a linguist really wants to invest himself or herself in, gaining knowledge about the domain, most people can do that. It takes time, of course. It doesn't happen overnight. But I think that's where I would say there is a difference between the linguists who are really performing in the life science industry and those who are less performing.
Yep. Thank you, everyone. Okay, we've got to cover a few topics this morning. So let's, although we could go in deep on all of these, let's turn to technology. So David, we've barely touched on technology so far. Tell me,
I think
what
it's
should people be considering?
it's an important topic. I think historically, life science organizations have had the capabilities to really just work with partners like Vistatec Life Sciences, right? The old adage, the traditional model of throwing everything over the fence has changed somewhat. And I think the life science companies' adoption of newer technologies is quite rightly, they're a bit more risk averse because of the heavily regulated nature of industry, right? But I think if we go further back from CAT tools to TMS, where I am now, to more what we're seeing today with organizations is more around digital transformation strategies, where we're seeing more centralization, where everything wants to connect to each other. I know we're touching AI later, so I won't even cover that just yet. But ultimately, in terms of interconnectivities with different systems that speak to each other, regulatory information management systems, eCOA systems, things like Medra or other kind of databases that are widely used. I think the adoption of digital transformation is something that we're seeing in the market. It is slowly getting there, and the traditional throw everything over the fence is kind of being moved away from, because I think that life science companies are recognizing that translation is of importance from a regulatory perspective. I remember one client telling me a product recall that they had problem with a translation was going to cost them $1 million per day. So that is, in dimes and dollars, substantial, right? So with technology in place, I think there's very many mechanisms that can utilize to help with that, I suppose, translation quagmire, if you will, right? I think there was kind of loads of different silos of linguistic technology, as well as industry-specific technologies not to plug Viva, but for example, everyone uses Viva, for example, for various different reasons, whatever kind of capacity that is, across regulatory affairs, clinical, pharmacovigilance, so on and so forth. But I do believe, in my experience at least, that over the last 20 years, that attitude has changed, and we're seeing that today.
Yep, thank you. Do you want to add to that, Eva, Bruno?
I can certainly add something to that, and I totally agree with what David said, because it resonates with me, with my own experience. So I can still see myself a few years back. I would say that, well, there is a challenge from a technology perspective, which is not specific to the life science industry, but which is, I would say, even more crucial in the life science industry, which is how to create and maintain an ecosystem, a tech ecosystem that is really supporting all operations related to translation or localization, but more generally supporting multilingual content operations. Because as I said before, content supply chains are more or less complex, more often complex than not, but okay, we can see different levels of complexity. And I think, there is nothing worse in a life science company, regardless of the size, by the way, but certainly in large multinationals, there is nothing worse than working with a bunch of tools and systems that are all over the place that may be working well or not, but that's not the point. The point is that you need to unify, you need to centralize as much as possible. It's never perfect, but you need to get this under control with an ecosystem. So the reason why I'm using an ecosystem, this is of course just to, if I can use the example or the analogy with the puzzle, when you make a puzzle, you don't put your pieces all over the place, all over the table. You want to bring your pieces together to create your puzzle. Well, from my own experience building, or I would say managing tech solutions in life science companies, it is to really, the name of the game is really to control and secure, security is important, these operations, rather than having to manage different bits and pieces. Bits might be bigger than pieces, but okay, I think the concept of ecosystem, which is, in my opinion, crucial in every industry, is even more crucial for the reasons I mentioned. So efficiency and security and sustainability in the life science industry. So that's my own experience.
Yep.
So I love that. I totally agree with all of that. And it just occurred to me that one thing people may not be aware of is that, or may not think about, is with all this complexity that you already have, if you have this ecosystem, when you have various disparate parts, and then you throw, I don't know, 20 languages with multiple providers in there, it gets exponentially more complicated. So by having that efficiency, there is going to be complexity if you have multiple languages, multiple products. But by having that efficiency and thinking that process through, you're going to really rein in that exponential increase in complexity once you add all those different languages and stages of development and what have you.
If we break those down into some even examples, right, I think even if we think about where translation comes into that, if we start upstream, and I think many of the people who are on this call, and ourselves included, have found this, and project managers in LSPs specifically, they get documents that are in non-editable formats, PDFs, non-ingestible elements, images, as you talked about there before, Eva, right? Preparing those is complex and labor intensive, especially if you think about a regulatory affairs or a marketing authority comes back to you, whatever that might well be. And I think, as you talked about there, Bruno, right, security is of paramount interest here, right? Because we're talking with highly sensitive documentation, drug development, for example, medical devices. They don't want that getting out into the public domain. So again, that also leads on further down the neck as well, right? So other things in terms of bottlenecks, desktop publishing, for example, or even feedback in the loop. How many times have we done that, right? In terms of LSPs, you go and make changes, track changes, come back, you could do the changes, and they're not updated into the traditional translation assets, whether that's terminology or translation memories, the feedback in the loop. And that's where errors and problems can creep in, right? and really slow down that process. I think the complexities that you talk about, Ava, is wide and varied, but they're the kind of some of the different things that we see. Well, I've seen specifically in my experience, right? And I think it's really, really important in that systematic feedback in the loop. We talked about it before about trust and relationship building that you have with your suppliers. I think that is really key, because if you're not having that dynamic feedback in the loop, it's going to affect you in the long run.
Can't disagree with any of that. I don't think. I do like a healthy disagreement from time to time in webinars like this, but I can't disagree with you. So, all right, AI wouldn't be a webinar in 2025 if we didn't touch on it. So, what can Gen AI do and not do in life sciences as it relates to localization? Let's start with you, Bruno, on this one. This is your wheelhouse, isn't it? One of your passions at this time, might even say.
Yeah, it's between passion and daily bread.
Right.
Well, there is quite a lot to say, but just to keep it concise for today, I would like to make a few points about indeed what generative AI can do and cannot do. And I think the first thing I would like to highlight is that I've noticed since the launch of ChatGPT that many people, including decision makers in the life science industry, are focusing a lot, too much in my opinion, but that's just my opinion, on what I call the downstream AI, which is, generative AI, it's going to create content, it's going to generate output that needs to be enriched, that needs to be, more or less corrected, etc. This is a very important discussion, don't get me wrong. But what I try to lead the discussions to is to tell those people that they should look at what I call upstream AI, generative AI. What happens before a model, whatever the model is, before a model is generating any output in any language? What happens before that? And I think that's critical, because if something goes wrong before that, the model itself can be blamed for generating output that is not right, but actually the model will not be the guilty person or the guilty component in this case. It will be one of the tasks that took place before. And that's why I would like to highlight the importance of data. And again, here data is different in my daily bread, so I'm not going to talk too much about that. But when we talk about training data, this is so critical. It's better to spend more time and a bit more money on this, because it will save a lot of time and money later on. Training data must be clean. Clean means relevant, means accurate, obviously, and have to be, of course, has to be trustworthy. So this is really a focus point for me, is what is the data that you are going to use? The data you are going to use is going to make your generative AI strategy good or bad, depending on how you used it, and even how you create those data. Because I can refer to a client last year, and that client called me because it was struggling just to create some training data in 5 languages. And this training data was actually coming from the conversion of files, PDF, Word, but also video and audio files into data. And this is another very important point from a translation localization perspective. Look at the quality, look at the effectiveness of these assets. I call these files assets in multiple languages, because in a number of organizations today in the life science industry, those assets are used to create the training data that's going to, of course, make the model more or less effective. That's the word I wanted to say. And then there is another point which is not really new, but I think this year will be quite an important year for small language models, because we talk a lot about LLMs, large language models. Some are good, some are not good, or not good enough for the life science industry. But what I noticed is that a number of leaders in this industry started already last year creating SLMs, small language models, and I prefer to use specialized language models because it was more cost effective, it was more accurate, and it was more sustainable. So there are a number of benefits, in addition, of course, to being compliant faster. But there is a number of benefits related to the model itself and what type of model you choose. So it's better probably to have small or SLM specialized models in some cases than other cases, because you don't have to be specifically big immediately, and you need to deliver effectiveness and compliance, and you need to make sure that patients all over the world, they get what they need when and where they want it. So that's the mission. And the last point about generative AI, and this is something I would like to convey to the language industry, is that there is an opportunity with this, game-changing technology to actually establish a very strong collaboration between the language community, so project managers, linguists, terminologists, and data scientists, because there are two types of expertise that are really crucial to deliver on generative AI, any generative AI strategy. It is the language expertise, and that comes from the language industry, and the data expertise, and that comes very often from the data science community. So if those two groups of people work together, or when they work together, they are really, I would say, in my opinion, they are a dream team to actually make generative AI even more successful than working on it separately. So these are the few points I wanted to just raise today.
Thank you. And let's note for all those listening, because it's a question I answer almost every time I ever talk to someone. No, it doesn't just work, and it's not just good enough just on its own without any upfront investment. It's not good enough. That's just the number of times I have to address that point and then continue the conversation in the way you just did, Bruno, is remarkable still. So, David, got anything to add on that?
Sure. Yeah, I think that is actually a very important point as well, right? The cost of these, right? And to Bruno's point, I think we've us within the language industry, we've known that LLMs is a natural progression from what we knew as neural networks, and then before that, phrase-based, rules-based statistical models, right? So we're all akin with training of data, using that as part of the process, right? But I think for LLMs themselves, they're effectively lessen the reliance on parallel data for the major languages that we see, right? But I think something that we do need to be cognizant of, and this brings it back, kind of loop to the very beginning of the discussion, is how do we manage with LLMs, essentially, how do we manage the translations for low resource languages, right? Because all of the data that's being ingested, and there's another point there, ethics, well, I remember, but partly because most of the data that's used to train these engines is in English, or with the more heavily resourced languages. So what do we do with that's available over the, let's say, 100 languages that we use globally? What about the 7,000 languages that we have? I know some of them are a bit more extinct, but it comes back to the low resource languages. My feeling is that there's a hype versus reality curve, and yes, it's a natural progression for us. And AI has some absolute. I was reading in the paper the other day where it's some advances of technical applications, such as medical image analysis to identify cancer early on, right? I think it was for breast cancer. Predicting the properties of proteins and all of these kind of other applications. But as it relates to us, I feel as though it's a natural progression. But I guess we have to be cognizant of the fact that we have to be careful from an ethical perspective, because we are dealing with highly sensitive content, patient data. Is it there yet? I still strongly believe that there has to be a human in the loop. So translators, don't worry. There's still a place for us in this world. I don't think that hype, I think we've seen it before with the machine translation hype. Everyone thought that Google Translate was just going to take over the world and we'd all be out of jobs. So I think, yeah, there's the whole hype versus reality scene. I do see the massive advances there from a productivity perspective, in terms of the amount of data that we have. But I think that there's work to be done as an industry. But I think ultimately how much money is going to be invested. Everyone's seen the news in the last few days, right? DeepSeek versus OpenAI, and how much money the US are investing, $500 million in doing all of this. But who's going to power that? Where's that going to come from? So I think there's a bigger discussion, a bigger topic to be had here.
Thank you. Eva, so the obvious question for linguists is that the role is changing, right? If we get into Gen AI, you have to be a subject matter expert to the extent that you can spot the flaws, right? Any thoughts or do you want to follow up on what the guy said?
Oh goodness. I'll try to keep it as short as I can, because of course I could take a multitude of angles here. Actually, I do want to follow up on something that Bruno said with the data scientists and the linguists. I feel like those two groups of people are often not connected. They also seem to speak a different language. They don't always respect each other as much as they should. And then there's also the issue if you've got, the content and the organization side of things, and then you've got an external language provider. How do you put those two together? That often there is no communication. So that's just a challenge. How do you navigate that? So that's something that needs to be, to bring it back to that whole concept of process, you really need to think through how are you going to do this. Now, as for what you asked about the changing role of translators, I'm going to say translators and localizers because people tend to dislike the term linguist on the provider side of things. I've seen some very unhappy reactions to that. You have to be almost a bit more of a proofreader, and you really have to be more of a subject matter expert. So it becomes less about typing what you're doing, but more about spotting any issues. And we all know about Gen AI and potential hallucinations. I'm talking too quickly because I want to get too much in. So that definitely happens. There's an issue of consistency in terminology, in form of address, in things that are done in separate at different times. Yeah, the role is definitely changing, and it requires a different type of expertise. One of the things that I've noticed is that people are so hyped up by AI that a friend of mine said that they let AI get away with quality. It's about 75% of what they'd let a human get by with, which of course, if you look at the medical industry overall, the life science industry, 75% quality is not where you want to be. It's not where you can afford to be. You can't have, it be 75% as good as it needs to be. It needs to be 100% or as close as you can get it. So that is definitely a topic. And I feel that with AI coming in, I could talk to machine translation, post-editing all day long, but I feel that really, again, it just needs to be a process that you think about. What are you going to tell people? Are you going to give people the terminology that you want? Are you going to give people, the resources they need to get the people the information they need to do the work well and to really be the quality control on the AI generate or AI influence in some way output, but you have to give them the resources to do that. It doesn't just happen in a void. You have to give them the information and make sure that communication works. So really, I always thought that when I started out in this, that this is all really about communication, intercultural communication, and it always comes back to communication. When you want a good product, you have to communicate between the people. You don't just throw a tool at it and expect it to be good, because a tool can do all sorts of things. And we talk about artificial intelligence, but it doesn't really think. So you need the people to really think things through. And that is something that we'll have to adapt to. And not every person in the translation field will do that, is able to do that. And people will come to the field who are new to it. And I'm noticing also that the terminology around that is changing. Just the other day, I got contacted by a recruiter, and they asked about, I think they called it multilingual copy editing. And it turned out to be basically localization. But that's what they were calling it. So there's just as David was mentioning, the hype versus reality curve, I think he called it. there is this triangulation between, there's a bit of a messiness at the moment of where were we, where are we headed? Things are happening quickly, but it's not happening at the same time. People's expertise is not developing in that sort of joint fashion. It's kind of here and there and all over the place. So we're just going to have to muddle through a bit, but getting that process and that thinking through the process before you get into it, and as you're in it, always doing those quality checks, I think is going to get us a good bit further along that road, if that makes sense.
It does. Very
I'm
much.
old enough to remember, Ava, when you talk about the change in terminology, but I'm actually old enough, can't speak for everyone here, but everyone, we used to use the words heavy editing and light editing instead of post editing. Remember those?
I do.
I also think a really interesting fact, I can't remember where I saw it was, is that despite where we are with LLMs and the hype and everything, translation is not actually one of the most utilized forms for LLMs. It's things like content creation, sales and marketing. People are replacing it for search engines, right? I mean, programming, education. So I think if you dug deep enough, I'd be curious to find out where within the scale of 1 to 100 translation would sit within these LLMs, right? I don't think it's going to move super quick because there's obviously subject matter technology expertise out there that still offer kind of machine translation capabilities, because that's really where we're looking at. But I think from a AI perspective and a Gen AI perspective, I think it's really just going to be more helpful, to your point, Ava, around I can't remember exactly the job that you've been offered, but rather than being a localization manager, it's more around utilizing different kinds of technologies to facilitate that, right? So I think for things like translation quality predictions, automating kind of workflows, and that's both on the life sciences side of things as well as within us as a localization community. I think the practicalities of it and the usage of Gen AI is more around productivity, really doing more with less resources, because typically speaking, to the very first comment you made, localization is always an afterthought, regardless of where it is in the organization, whether it's content creation, oh, I must get this translated.
Thank you. You know what, guys? We have a lot of questions here, so I think we should turn to the audience questions. So I see them. So first one, how do you handle audit trail for all versions and updates made to documents, protocols, ICFs during the translation process? Okay, do we have someone who wants to tackle a quality management system question? Anyone? No. Okay.
I can. This is something. This is something that we have to. We come up against,
time, right?
Yeah. So yes. Version control, and let me just bring the question up again. I forgot the question. So
yeah, audit trail. How do traceability?
Trail. Yeah, I think it's really, really important. Even how many times have we all done CAPA resolutions and all of these various different things, right? It can take weeks or months. I think that's where technology is pivotal. I think from a version control perspective, if we talk about a regulatory submission, that can be done within an application like a RIM solution, for example, that then can have a feedback in the loop to translation technologies or QA tools or whatever that might well be. I believe that from a version control perspective, it shouldn't be sat on someone's desktop, on their laptop. I think there is technologies out there where we see that as well, that we can help support that version control and help your clients, or help the clients help you with in terms of a supplier ecosystem.
Yep, thank you. Yes, it's all about content management systems and the quality management system and the like, isn't it? Okay, we've got a few, so I'm going to keep going. This one, here's one for Bruno. Can you speak to the pros and cons of handling localization, presumably in-house versus outsourcing our localization services? So you're the man. So you set a team up of 250 people, right? To handle localization in-house. So that was an endeavor, I imagine.
Yeah, it was quite a
Pros and
challenge.
cons. Yeah.
Yeah, most of all because it was during the COVID, so I couldn't really travel. I couldn't really meet people in person. So yeah, situational management, as it's called. So yeah, that's a very good question. I think the reason why I was recruited to build such a team from scratch, and over the years I saw other examples in the life science industry. There is a big team in AstraZeneca, in Pfizer, etc. The main reason was that over the years, the CRO I was recruited by was not happy about not just the quality or the effectiveness of the contents that was delivered by suppliers, but also by the engagement of these suppliers. They were acting as vendors, transactional vendors. Give me your file, I'll give them back to you in 25 languages. There was and I have to say that I saw it when I joined that company, and I saw that indeed it was not really about business partnership. It was more about vendorship, which for a big life science company is not the ideal format, in my opinion. But the rationale the rationale for internalizing, that was the word, how to internalize localization operations. The rationale was based on leveraging the expertise and the experience that is in the company. So we had a number of people to review content. We had a number of people to create content. But of course, we needed a separate entity to actually make sure that everything was orchestrated in the company between the different teams as well, between pharmacovigilance, between pharmacovigilance and real-world evidence, for instance, just as an example. So leveraging the internal expertise, that was more cost effective. So that there were some projections being made about what would it be. It was not just about savings; it was about cost effectiveness. So how to use the money in the best way. Sometimes it was not only about spending less; it was about spending money better within the company. The other reasons, or the other parts of the rationale, were related to security. Because for a big CRO, just like for any big company in the life science industry, it's quite sensible to avoid dealing with external systems. So everything was with an internal team. Everything was managed in-house, so no leaks, no risk, etc. And last but not least, it was, and specifically for the CRO world. So I know, David, you worked also for another CRO. The rationale was also about building a team internally first to make sure that localization operations could be managed in-house. But the goal for internalization was also to be able to offer services to other companies in the life science industry. Specifically in the CRO world, because CROs are working with a bunch of people, with a bunch of companies, medical devices, biotech, etc. So these companies, a number of these companies, medium size or small size, were not able to have an internal team. So it was an opportunity, in my case at least, to build a team that was serving internal purposes, but also serving clients from the CRO. So, but I would say most of the rationale was about effectiveness, cost and time effectiveness, because cost cost and speed are of the essence in the life science industry, and security, because there were some bad experiences in the past. So, but it may depend for other companies. But
yes, I was going to say, so that's some pros. Who wouldn't want to internalize? What kind of investment? Any thoughts on that?
Yeah, it has to be balanced, in my opinion. Before working for this CRO, I was working in a BI company, business intelligence company, and I created a team as well from scratch in that company. So it's I'm a serial creator. The reason why I was still working with external suppliers in my previous company not in the CRO, but before, was that I was able to work with suppliers, LSPs, that were more than suppliers. They were fully embedded in the processes, in the supply chains. They were acting as partners more than suppliers. In the case of the CRO I worked for, the experience was totally different because suppliers didn't want, or they couldn't be engaged, embedded in content operations. So the C-level of the CRO company decided that, in that case, it was probably better to have an internal team.
So it's all about finding trusted partners.
Yeah, I think the quality of relationship is really important. Beyond technology, beyond business processes, it's a people industry, So it's really important to keep that in mind. But of course, factors like security, like sustainability, and even, as I said, business opportunities simply. I know that other companies are doing it in other industries. In the BI industry, my team was working with clients, so I was buying and I was also a supplier myself.
Yep.
So it's a very interesting position to be in, to be honest. Yeah.
Any thoughts on that, David, Eva, or shall we tackle one of these other questions?
Just one of the straight up answers is obviously, if you don't have the scale, you won't be able to build an in-house operation. If you're a large company, you can do that. If you're a very small operation, that's just going to be very difficult. But the concept of having trusted partners and that concept of embeddedness kind of comes back to that communication element. Like, you really need to have that back and forth and be as close as possible. So maybe there's some in between you can find to having these external suppliers that you just send the documents to and have them translated by, versus having somebody in-house. But maybe there's some in between that you can find if you're a smaller operation that can't do that for various reasons.
I think we would say we're in that sweet spot, aren't we, David? And you and
yeah, I mean,
us.
all I was just going to add to that is that if you're going to go kind of like freelance network, that takes a hell of a lot of investment of your own time, as well as investment of time from your freelance network, because obviously they're freelancers by nature and they might not necessarily just be working for you unless you can kind of give them that. So I think being cognizant of the fact that that does take time. So it's a happy medium, I would say.
Yeah. Very good. All right, let's try and squeeze in one or two more of these. Okay, Eva, you spoke about pediatric trials earlier. Those often require long-term follow-ups. How do you maintain translation consistency across years, especially as children transition to adult care?
Oh, goodness. So how do we tackle that? So one of the things I would say is maintaining consistency with who you work with. I have often seen on the receiving end from LSPs that you just get, a document that you've never seen before, and the only clue that's for children is that they have a required age range, and then you never see that document again. So you want to work with the same team, internal or external, and an LSP who's cognizant of that. I would think content management and tools would play a role in tracking that as well, keeping that content separate from other trials, for instance, so not mixing things too much, so that you can ensure that you are staying consistent with that. I think maybe David and Bruno can speak a little bit more to that side of things.
Yeah, sorry. I think there's obviously by nature you're adapting you're maturing from a child to adult care. So the language would need to mature, but I think in terms of the long-term follow-ups, it's really kind of feedback in the loop because this is what the trials are for, right? They are there to help develop drugs to improve people's lives. So ultimately, I think from a cultural and a educational level and a maturity perspective, I think those kind of elements need to be thought about. And of course, being very subjective here, technology would play its part.
Yes, it would indeed. Thank you. Okay, let's squeeze one more in. Have you seen, this is an opportunity for war stories, people. Have you seen it, short war stories? Have you seen instances where poor translations led to regulatory delays or rejections?
Yes.
Okay, bring it.
No, you said keep it short. So we've seen many horror stories. I think we talked about one before, right, where client was talking around it costing them $1 million a day for a product recall from a translation.
That's just shocking.
A day, and the yeah, you know, I've heard even more horror stories, but I'll let other people have a go.
Bruno, got any horror stories? Brief
Oh yeah,
ones?
just like David, I did hear and see some worst stories. Of course, I cannot reveal them now and say all the details, but I think the root cause of these worst stories were not just the quality of translation, but it was also a misunderstanding in the SOP with a client, for a client. SOP is standard operating procedure. There was actually a misunderstanding about, you know, the level of quality that was required. Because, you know, in my experience, it's really crucial to define that very well and clearly for everybody in the SOP, so that there is no complaint afterwards, or there is no sort of backfire afterwards. So the quality is one thing, and of course, when it's bad quality, it leads to rejection. But there is also misunderstanding again, you know, upstream, which is okay. How do we define that in the ways of working and the SOPs? That's very important.
Thank you. Anything you want to add, Eva? No. In that case, so I will answer the remaining questions myself afterwards for our guests. I'd like to ask you if you have any final thoughts to take away for the audience. There are some common threads that we've covered in the past 45 minutes, aren't there? So I'll go ladies first. Eva, you want to go first?
I'm going to end up where I started. It's a process, and we've just heard very impressively, I think, that you need the processes, you need the technology, and you need the people, and you need to get it right. You need to think about it and not just have it be this thing that's tacked on at the end. So if you're tasked with localization, especially if you're new to it, make sure you have all information, make sure you have the people, the processes, the technology in place, and that everybody's clear on that. And, you know, it's a feedback loop. So I think we can all agree that that's where we need to be, working with good people, with good technology, with good processes, and then you'll be sailing through it.
Thank you. Bruno?
Well, probably the same thing. It's my daily life in this industry is made of a combination between people, processes, and technology. Of course, now generative AI is infused in this combination to make people faster, to make them more productive, to make translation technology also faster and more productive. But at the end of the day, it's all about this combination, what I call the dream team. But there is no one size fits all. So when I say a combination, there are actually multiple combinations. It has to be scaled according to the purpose, to the value that needs to be created, and to sometimes to the sub-industry. Medical devices have different requirements sometimes than biotechnology.
Thank you. David?
And I agree with all of that, but I would just caveat that by saying we are blessed to work in this industry, and we have a wonderful community. So anyone that is challenged, I would say reach out to the community and just ask for support, because there is people, Eva, Bruno, Karen, that know a lot of people, that know a lot of, and community means sharing and caring, right? So yeah, I would say reach out, ask for help.
Yeah, I just want to jump in on that really briefly, because I think that's really important. This industry generally tends to be very, very giving. People recommend each other. If there's a language or topic I don't know, or some technology element I don't know, I will refer you to somebody else. I'm sure David would do the same. Bruno would do the same. Everybody I know in this industry who has lasted does the same. So that's a great point, David.
Lovely way to end, indeed. So we could talk about this for hours, but let's honor the time we set for this, and it's time to wrap it up. So a huge thank you to you three, Eva, David, and Bruno, for joining us today and for sharing all these insights. And a big thank you to our audience for attending and for adding some great questions there. So thank you all, and goodbye.